Okay, good morning, very good morning to everyone. I'm Dr. Ganesan R, Associate Professor, Department of Physiology, and Sri Lakshmi Narayana Institute of Medical Science, affiliated under Bharat Institute of Higher Education and Research. So today I'll be taking a topic from physiology, micturition reflex and abnormalities of bladder. So first, to start with, we'll see about the ureters and kidney. So we all know kidneys. We have two kidneys in our body. The main function of the kidney is to form the urine from the blood. So from the blood, the kidneys will filter urine, and whatever filtered urine will enter into the ureter, both the ureters, and from the ureters, the urine will enter into the bladder. So urine will be stored in the bladder for some time. Once the bladder is filled, it will be voided into the urethra. Okay, this is a normal physiology. Okay, so the angle at which the ureters open into the bladder, so this angle will prevent the reflex of urine from the bladder again into the ureter. Okay, so this angle where this two ureters enters into the bladder, this angle will prevent the reflex of urine from the bladder into the ureter. Okay, so this point where the ureter, both the ureters enter and they end in the bladder. So this point is called as trigone of the bladder. Trigone of the bladder. Okay. So function of the ureter is to convey urine from the kidney into the bladder. So the angle that ureter pass through the bladder wall will prevent the reflex of bladder, reflex of urine from the bladder into the ureter. Okay, so now we'll see about the anatomy of the bladder. So we'll see the anatomy here. So this is the bladder. So bladder has a body and a neck. Okay, so neck and the body. These are the two parts of the ureter, and this area is called as trigone. So this area is called as trigone. Why it is called as trigone? Because these two ends. This is where the ureter. So both the ureters will end here, and this point is where the urethra will start from the bladder. Okay, so this triangular area is called as trigone of the bladder. Okay, and this is called as body of the bladder. So this body of the bladder is having a muscle called detrusor. Detrusor muscle is present at the body of the bladder. Okay, so this detrusor muscle is a smooth muscle. Smooth muscle. Okay, you have to know that this detrusor muscle is a smooth muscle. Okay, and in the neck of the bladder, we have a sphincter called internal urethral sphincter. Internal urethral sphincter. Okay, this internal urethral sphincter is present at the neck of the bladder, and this internal urethral sphincter will prevent the bladder, will prevent the urine from bladder into the urethra. Once this internal urethral sphincter relax, then only the bladder from the urine from the bladder will enter into the urethra. Okay, and it also acts as a one-way valve. Okay, from the urethra, urine cannot again go back to the bladder because of this internal urethral sphincter. Okay, so this internal urethral sphincter is acting as a one-way valve, so it will allow the urine to flow from bladder into the urethra, not from the urethra to the bladder. Okay, and we also have one more sphincter at the region of urethra. Okay, this sphincter is called as external urethral sphincter. Okay, so this external urethral sphincter is present at the junction between urethra and the bladder. So this internal external urethral sphincter, once it relaxes, then only the further flow of urine will be there in the urethra, or else urine flow will not be there. Okay, so this external urethral sphincter is made up of skeletal muscle. So the voluntary control of micturition is through the external sphincter. Okay. So here three important things you should know. So detrusor is a muscle which is present in the body of the bladder, and this detrusor muscle is a smooth muscle. Smooth muscle. Okay. And internal urethral sphincter is present at the neck region of the bladder. Okay. So this internal urethral sphincter is again made up of smooth muscle. Okay, and external urethral sphincter is present at the region of urethra, and this is made up of skeletal muscle. Okay, so now we'll see the slide here. Okay, so the bladder is having body, trigone, and the neck. Okay, neck contains internal urethral sphincter, and the trigone is a triangular area where both the ureters and urethra will pass. And body of the bladder contains a muscle called detrusor muscle, which is a smooth muscle. Okay, the contraction of this detrusor muscle will help in emptying the bladder. Okay, and this internal urethral sphincter will prevent the reflex of semen into the bladder. Okay, you all know. So semen and urine both comes from the urethra only. So this internal urethral sphincter will prevent the reflex of semen into the bladder. Okay, and external urethral sphincter is present at the region of urethra, and it is always remain in a contracted state. Okay, this prevents dribbling of urine from the urethra. Okay, and here we have given the capacity of the bladder. So at birth, the capacity of bladder is up to 20 to 50 ml only. It is small size bladder. At 1 year, the bladder size will increase up to 200 ml. Then adults will have a size of 600 ml. Okay. Now coming on to innervations of bladder. Innervations means we are going to see about the nerve supply of the bladder. Okay. So before going to the slide, we'll see the diagram first, and then we'll go to the slide. Okay. So this is the bladder. So this is the body of the bladder. This region is the neck of the bladder, and this is the urethra. Okay. So in the body of the bladder, we know we have a muscle called detrusor muscle. Detrusor muscle. Okay. This detrusor muscle is a smooth muscle. Okay. And at the neck region, we have a sphincter called internal urethral sphincter. We know that is also a smooth muscle. Okay. So smooth muscles in our body, they are supplied by autonomic nervous system. That is parasympathetic and sympathetic nerves. They supply the smooth muscles in our body. Okay. Here also the parasympathetic nerves and sympathetic nerves only supply the detrusor muscle and internal urethral sphincter. Okay. The parasympathetic nerves would supply the bladder body, that is, which supply the detrusor and internal urethral sphincter, are coming from the spinal segment S2, S3, S4. Okay, so sacral segment S2, S3, S4. These are the segments. They are supplying the detrusor muscle and the internal urethral sphincter. Okay, the nerves which are arising from S2, S3, S4 segment together they called as pelvic nerves. Together they are called as pelvic nerves. Okay, and the sympathetic nerves which are supplying the detrusor and internal urethral sphincter, they arise from L1, L2 segment of the spinal cord, and they together called as hypogastric nerve. Okay, so parasympathetic nerves and sympathetic nerves, they supply detrusor and internal urethral sphincter, because these detrusor and internal urethral sphincter are made up of smooth muscle, so they are involuntary. They are involuntary because they are supplied by autonomic nerves. Okay, mainly the sympathetic and parasympathetic nerves. Okay, the sympathetic nerves are coming from L1, L2 segment, and they are called as hypogastric nerve. And the parasympathetic nerves are coming from S2, S3, S4 segment of the spinal cord, and they are called as pelvic. Okay, so this pelvic nerves and hypogastric nerves, they act as motor nerves for the detrusor and internal urethral sphincter. Okay, when the pelvic nerve is stimulated, what happens is the detrusor will contract. The detrusor contracts, the bladder will contract. Okay, when the bladder will contract means what will happen to the urine filled in the bladder? It will empty into the urethra. Okay, so when pelvic nerves are stimulated, they will contract the detrusor. Same time, what has to happen to the internal urethral sphincter? It has to relax. Okay, so internal urethral sphincter will relax and the detrusor will contract. So these two things will empty the bladder into the urethra. Okay, so pelvic nerve, which is the parasympathetic nerve, is responsible for emptying the bladder. This you should have in the mind. Okay, next coming to the sympathetic nerves. The sympathetic nerves are coming from L1, L2 segment. They are called as hypogastric nerve. What they will do is they will relax the detrusor. They will relax the detrusor muscle and they will contract. They will contract the internal urethral sphincter. Okay, so this will cause filling of the bladder. This will cause filling of the bladder. Okay, the nerve for filling is sympathetic nerve, and the nerve for emptying is parasympathetic nerve. Okay, and then External urethral sphincter, I told you, it is made up of skeletal muscle. The skeletal muscle is a voluntary muscle. So this is supplied by somatic motor nerve. Somatic motor nerve, namely the pudendal nerve. The pudendal nerve. Okay. So these are the three nerves you should remember. Parasympathetic nerves are coming from pelvic nerve. Sympathetic nerves are coming through hypogastric nerve, and somatic motor nerves are coming through pudendal nerves. Pudendal nerves. Okay. So the detrusor and internal urethral sphincter, they are smooth muscles. So they are supplied by parasympathetic and sympathetic nerves. And external urethral sphincter is made up of skeletal muscle. So it is supplied by somatic motor nerve, that is the pudendal nerve. Okay. So here you have to note a point that the pudendal nerve and pelvic nerve, they are arising from same segment of the spinal cord. S2, S3, S4 segment of the spinal cord. Okay. So you all know the spinal cords will have three arms in them. The gray matter of the spinal cord will have three arms. Okay. Anterior arm, posterior arm, and lateral arm. Lateral arm. Okay. So through the anterior arm of the spinal cord, this motor nerves will arise. So the pudendal nerves are coming from anterior arm cells of S2, S3, S4 segment of the spinal cord. Okay. Whereas the pelvic nerves, they are coming through lateral arms of the S2, S3, S4 segment of the spinal cord. Okay. So this is the difference you should know. Okay. So far, what all nerves we have read? Okay, this pelvic nerve, hypogastric nerve, and pudendal nerve. All these three nerves, whatever we have read till now, it is they are motor nerves. They are motor nerves. Okay. Additional to this, we also have a sensory nerve that is supplying the bladder. Okay. So these sensory nerves are also called as pelvic nerves, and they also go to S2, S3 segment, S2, S3, S4 segment of the spinal cord, but they go to the posterior arm of the S2, S3, S4 segment of the spinal cord. Okay. So whenever they ask you the nerve supply of bladder, what you will say? The bladder is made up of detrusor and internal urethral sphincter. These two are smooth muscles, so they are having parasympathetic and sympathetic nerve fibers supplied. Okay, so the parasympathetic nerves are coming through S2, S3, S4 segment of the spinal cord, and they are together called as pelvic nerves. Okay, and sympathetic nerves are coming through L1, L2 segment of the spinal cord, and they are together called as hypogastric nerve. Okay, so this pelvic motor nerve and hypogastric motor nerve, they supply the detrusor and internal urethral sphincter. Okay, and external urethral sphincter is made up of skeletal muscle, so it has to be supplied by a voluntary nerve, that is somatic motor nerve. It is also coming through S2, S3, S4 segment of the spinal cord, and this nerve is called as pudendal nerve. Okay, so all these three nerves are motor nerves. Okay, so what will happen if pelvic motor nerve is stimulated? The bladder will contract. Okay, the detrusor will contract, and internal urethral sphincter will relax. So bladder will empty. That is a function of pelvic nerve. What will happen if hypogastric nerves are stimulated? The detrusor will relax and internal urethral sphincter will contract. So this will allow filling of the bladder. This will allow filling of the bladder. Okay, these two things you should know. What will happen if pudendal nerve is stimulated? Pudendal nerve is stimulated. What will happen? External urethral sphincter will close. So urine cannot pass through the urethra. So it will still be in the urethra and the bladder. Okay. If pudendal nerve is inhibited, then urine can pass through the urethra, micturition can happen. Okay, so these are the things you should. In addition to this three motor nerves, we also have a sensory nerve that is called as pelvic nerve, pelvic sensory nerve, and pelvic afferent nerve. They also supply the bladder. Okay, so see here, the parasympathetic nerves are through the pelvic nerve, sympathetic nerves are through the hypogastric nerve. So the pelvic nerves are arising from lateral on cells of S2, S3, S4 segment of the spinal cord, whereas hypogastric nerves are arising from lateral segments of lateral on cells of L1, L2, and L3 segments of the spinal cord. So both pelvic nerve and hypogastric nerve, they are going to supply the body of the bladder and neck of the bladder. So in the body of the bladder, we have the detrusor. In the neck, we have the internal urethral sphincter. Okay, so these two structures are supplied by this pelvic and hypogastric nerve. Okay. So when pelvic nerve is stimulated, what they are doing, they are causing contraction of the bladder. That is, they cause contraction of the detrusor and they relax the internal urethral sphincter. So this will allow the emptying of the bladder. Okay, when hypogastric nerve is stimulated, what will happen? They cause contraction of the bladder neck. That means they cause contraction of the internal urethral sphincter and they relax the detrusor. So they allow filling of the bladder. So one more now I told the bladder is supplied by another nerve called pudendal nerve. So this is a somatic motor nerve. It is voluntary control nerve. It is coming from anterior onsides of S2, S3, S4 segment of the spinal cord. Okay, anterior onsides of the S2, S3 segment of the spinal cord, and they supply external urethral sphincter. This external urethral sphincter will be closed if the pudendal nerve is stimulated. So you can see a summary of innervations of bladder. Okay, so this is the bladder body. It is made up of detrusor. This is the bladder neck, which is filled with, which is made up of internal urethral sphincter, and the proximal portion of urethra that is guarded by your external urethral sphincter. Okay, so this detrusor and the internal urethral sphincter, these two are made up of smooth muscle. So they're going to have parasympathetic nerve and sympathetic nerve. The sympathetic nerves are coming from L1, L2 segment. They are called as hypogastric nerve. So they cause relaxation of the detrusor and contraction of the internal urethral sphincter. So that will lead to filling of the bladder, filling of the bladder. One more function done by sympathetic nerve is they are closing the internal urethral sphincter. So therefore, the semen cannot pass through the bladder. Semen cannot enter into the bladder. So internal urethral sphincter is contracted. So during the time of ejaculation, the semen cannot enter into the bladder. This is prevented by sympathetic nerve, which are closing the internal urethral sphincter. Okay. Next, the parasympathetic nerves are coming through the S2, S3, S4 segment, lateral onsides of S2, S3, S4 segment of the spinal cord, and they cause contraction of the detrusor and relaxation of the internal urethral sphincter. So this will cause emptying of the bladder. This will cause emptying of the bladder. Okay, and then somatic motor nerve, pudendal nerve, they are coming through S2, S3, S4 segment of the spinal cord, and they are supplying the external urethral sphincter. So this stimulation will close the sphincter, therefore urine cannot pass through the urethra. So coming on to the functions of bladder. So functions of bladder, it has two distinct functions. One is storage of urine, next is voiding of urine. Okay, storage of urine, voiding of urine. This voiding only we call it as micturition. Okay, so first we'll see about the storage space. Storage space. So storage space is possible because of the compliant nature of the bladder. Okay, so bladder can store urine to a larger extent without any increase in the pressure. Okay, if there is increase in the pressure, what will happen? It will cause pain sensation. Okay, it will cause pain sensation, right? So when the urine starts filling in the bladder, the bladder will adjust to a extent so that there is no increase in the pressure. The bladder pressure will stay low because of the highly compliant nature of the bladder. So this highly compliant nature can be attributed to the transitional epithelium also. Okay, so transitional epithelium is lining the bladder wall, and because of this epithelium, the bladder will remain highly compliant. Okay, the function of the storage space can be studied by a experiment or a method called cystometrogram. Okay, cystometrogram. Okay, cystometrogram means what? I will explain with this graph and then we'll go to the slide. Okay, so what they are doing here? So cystometrogram means it is a graphical representation between intravesicular volume and intravesicular pressure. Okay, so they study the relationship between the intravesicular volume and the intravesicular pressure. Okay, so what do you mean by intravesicular volume? So intravesical volume means vesicle means bladder. So inside the bladder, what is the volume? Okay, If volume increases inside the bladder, how much pressure is increasing in the bladder? That is studied in cystometrogram. Okay. Cystometrogram is studying the relationship between it is a curve which studies the relationship between the intravesical pressure and intravesical volume. Okay. So how this method is done is, first what they will do is, they will insert the catheter into the bladder. Okay, through the catheter, they can infuse saline water into the bladder. Okay, and they have kept a special transducer also inside the bladder. Okay, so when the bladder is filling with water, what will happen? The pressure will increase inside the bladder. That can be studied using this transducer. Okay, so when they did this experiment, what they found out is they found three phases. They found three phases. Okay, phase 1A, phase 1B, and phase 2. Okay, in phase 1A, what they found out is initially when the bladder is empty, it is having zero volume. Okay, so at that point, when you infuse 50 ml, when you infuse 50 ml of water, 50 ml of water, 50 ml of water, when you infuse, the bladder pressure has increased from 0 to 10 centimeter of water. So phase 1A, what this phase represents, when the bladder volume is increased from 0 to 50 ml, the bladder pressure has increased from 0 to 10 centimeter of water. Okay, this is phase 1A. After that, when the bladder volume is increased from 50 ml to 400 ml, there is no increase, or there is very slight increase in the pressure. Okay, this is phase 1B. This is also called as plateau phase. Okay, and then after 400 ml, if the bladder volume is increased, then the pressure inside the bladder is markedly increased. This is phase 2. Okay, so we have three phases: phase 1A, phase 1B, and phase 2. Okay, so in phase 1A, what we found out, when the bladder volume is increased from 0 to 50 ml, the bladder pressure has increased from 0 to 10 centimeter of water. And further, when we increase the bladder volume from 50 ml to 400 ml, the bladder pressure remained the same, or there is one slight increase in the pressure. Okay. Beyond 400 ml, when we increase the bladder volume, the pressure increased sharply. Okay. This is phase 2. Okay. So phase 1A is initial slight rise. So when the bladder volume is increased from 0 to 50 ml, the pressure increased from 0 to 10 centimeter of water. This is phase 1B. It is called as long flat segment or the plateau phase. So it is produced when the bladder volume is increased from 50 ml to 400 ml. The pressure remained the same. Okay. And beyond 400 ml, when we increase the volume, the pressure increased sharply. That is phase 2. Okay. So phase 1 and phase 1A and phase 2, you all can understand, because when volume increases, pressure will increase. Okay, this is normal phenomena. But what happens in phase 1B? Why, even though the volume is increasing, why the pressure is not increasing? Why there is a plateau phase? That is explained by law of Laplace. That is explained by law of Laplace. What this law of Laplace says is, when states that the law of Laplace states that the pressure inside a spherical viscous, that is, a bladder is a spherical viscous organ. So the pressure inside the bladder is equal to twice the wall tension divided by radius. The pressure is equal to 2 times the tension divided by radius. So initially, when the bladder volume increased from 0 ml to 50 ml, 0 ml to 50 ml. So what happened? The tension increased, but the radius doesn't increase much. Okay, because of that, the pressure has increased. But from 50 ml to 400 ml, when the volume increased, the tension increased, but at the same time, the radius also increased. From 50 ml to 400 ml, the tension increased, but at the same time, the radius also increased. So both numerator and denominator increased. So because of that, what happens? The pressure remained normal. Okay, in case of the bladder, the tension increases as the organ fills, but the radius also increased. Because of that, the pressure increase is very slight. Okay. But beyond 400 ml, what happened? Beyond 400 ml, the bladder cannot stretch. The bladder cannot stretch. So the radius cannot be further increased. Only the tension will be increased. That causes sudden increase in the pressure. That causes phase 1, phase 2. Okay. So phase 1A is because of phase 1A. When you increase the bladder volume from 0 to 50 ml, the tension alone increase, the radius increase is very less. So because of that, pressure is increased from 0 to 10 centimeter of water. Beyond 50 ml to 400 ml, when you increase, the tension increases as well as the radius also increase. Because of that, pressure remain the same. Beyond 400 ml, when you increase, the radius cannot be increased further, only the tension can be increased. That leads to sudden increase in the pressure that we saw in phase 2. Okay, so till now we have seen about anatomy of the bladder, nerve supply of the bladder, and we have seen about the storage phase, we have seen about the cystometrogram. Now we are going to see about the micturition. Okay, so what do you mean by micturition? Micturition means it is a periodic evacuation of the urinary bladder through the urethra. Okay, so bladder is filled with urine. Now it has to empty it. Okay, periodic emptying of the bladder through the urethra is what we call it as micturition. Okay, usually this micturition will happen via reflex. Okay, spinal reflex. Usually it is a micturition happens through spinal reflex only, but it can be modulated. It can be facilitated or inhibited by your higher brain centers. Okay, so the center for maturation, the center for maturation. Okay, so the maturation, the center for maturation is spinal cord only, but it can be facilitated or inhibited by your higher brain centers. Okay, so maturation reflex, we all know it is a periodic, complete voluntary emptying of the bladder. It is usually mediated by your spinal cord, but can be influenced by your higher centers. So there are some centers which are facilitatory and some are inhibitory. Okay. So we'll see the reflex first, then we'll see about the higher centers. Okay. So you can see, so any reflex when you study, that first thing you should know is stimulus. What is the stimulus for that reflex? Okay. And what is the stimulus for your maturation reflex? The stimulus for maturation reflex is filling of the bladder with urine. Okay. When the bladder fills with urine, it begins to stretch. Okay. When the bladder stretches, the stretch receptors will get activated. Okay, when the stretch receptors are activated, what will happen? The afferent pelvic nerve will get activated. When the afferent pelvic nerve is activated, it will give the information to sacral segment of the spinal cord. From the sacral segment, the efferent pelvic nerve will start. The efferent pelvic nerve will cause contraction of the detrusor and relaxation of the internal urethral sphincter. So the urine from the bladder will enter into the urethra. So in the urethra, we have external urethral sphincter. When this external urethral sphincter relaxes, then what will happen? The urine will flow, maturation will happen. Okay. So whatever we have discussed, I'll give it in a flowchart manner. You can see that also. So first, the stimulus for the maturation reflex to happen is filling of the bladder. When the bladder is filled, okay, when the volume reaches 450 ml, the bladder will stretch and will stimulate the stretch receptor. Okay, this stress receptors will stimulate the pelvic nerve, afferent pelvic nerve. This afferent pelvic nerve will stimulate the motor pelvic nerve, efferent pelvic nerve. Okay, this efferent pelvic nerve will cause contraction of the detrusor and relaxation of the internal urethral sphincter. This contraction of the detrusor and relaxation of the internal urethral sphincter will allow the urine to flow into the urethra. And in the urethra, the stretch receptors are again stimulated and they are stimulating the pelvic afferent nerve. And this pelvic afferent nerve will inhibit the pudendal nerve. So this will cause relaxation of the external urethral sphincter and this will result in urination. This happens as a reflex. Okay, the center for this reflex is present at the sacral segment of the spinal cord. So whatever we discuss in the flowchart manner, we'll see it in the diagram manner also. You can see here, this is the bladder, it is going to fill with urine. When the bladder filled with urine, it will stretch, the stretch receptors will get activated, and this stretch receptors will activate the afferent pelvic nerve. This afferent pelvic nerve will give the information to S2, S3, S4 segment of the spinal cord. From this segment, the efferent pelvic nerves will start, and they cause contraction of the bladder and relaxation of the internal urethral sphincter. So this will empty the urine into the bladder, from the bladder into the urethra. When the urine reaches the urethra, the urethra will stretch, and again it will activate the afferent pelvic nerve. This afferent pelvic nerve now going to inhibit the pudendal nerve, which will relax the external urethral sphincter, and the urine will happen, urine flow will happen. Okay, this is what happens in micturition reflex. This micturition reflex is controlled by your higher centers in the brain. Okay, so your posterior hypothalamus and pons, they will facilitate. That is, they will allow the maturation to happen. Okay, and this cerebral cortex and midbrain, they will inhibit the maturation process. Okay, so this facilitation and inhibition will depend upon the environment you are present. Okay, when you're sitting in a classroom or in a meeting, that time, even though the maturation reflex is started, you cannot maturate, right? So what will happen now? The inhibitory center, that is your midbrain, will inhibit it by stimulating the pudendal nerve. And the midbrain now will stimulate the pudendal nerve. So pudendal nerve will cause closure of the external sphincter, and the maturation will be stopped. Okay, but when you're in your room, hostel room, or in your house, that time when the maturation reflex is initiated, that time you're free to go to the toilet, right? So that time your facilitatory center, that is your posterior hypothalamus and pons, will facilitate. That will they will inhibit the pudendal nerve, and they will relax the external urethral sphincter and cause maturation to happen. Okay. So in what way these IS centers are helping you? The IS centers will keep the maturation reflex partially inhibited, especially when there is except when there is desire for maturation. That is, whenever the environment is favorable and you feel like maturity, that time only maturation reflex is fully happening. The other times they are partially inhibited. Okay, and this IS centers also prevent the maturation even when the reflex is initiated. Even when the reflex is initiated, you can voluntarily control the maturation. This is through the IS centers in your brain. Okay, but when the bladder is filled beyond 700 ml, this voluntary control is not present. The urine will dribble into the urethra. Okay, the maximum capacity of bladder is reached. The urine will dribble into the urethra. Now coming on to various lesions in the bladder. So we'll study three lesions of bladder. So one is diabetic bladder. It is also called a atonic bladder. Okay, what will happen here is the afferent pelvic nerves are damaged. Afferent pelvic nerves are damaged due to some disease called tabes dorsalis. Tabes dorsalis is a tertiary stimulus which mainly affects the sensory nerves. Here, the afferent pelvic nerves are damaged. So what will happen now? The bladder will fill, but the bladder is filled, that information should go to the spinal cord through the afferent nerve. But these afferent nerves are damaged. So what will happen? The bladder will keep on fill, but the afferent pelvic nerves are not stimulated because there is no afferent pelvic nerves to stimulate the afferent pelvic nerve. So what will happen? The bladder will fill to a greater extent, and then there will happen overflow incontinence because of increased pressure. Then mechanically the internal urethral sphincter will open, and the urine will dribble into the urethra. Overflow incontinence will happen in diabetic bladder or atonic bladder. So there is second condition called denervated or decentralized bladder. So what will happen here is both the afferent and efferent pelvic nerves are cut. Both the afferent and efferent pelvic nerves are cut in a cauda lesion. Okay, cauda lesion, both afferent and efferent pelvic nerves are cut. So both parasympathetic nerves are cut. So what will happen now? The bladder size itself will shrink. Bladder will get shrunken and get hypertrophied. And what will happen now? The bladder capacity is very less. Because it's shrunken, the bladder capacity is very less. Only to 25 to 50 ml it can hold. And beyond that, it will cause dribbling of urine. Okay, this is denervated or decentralized bladder. Okay. So third type of disease we are going to see is damage to spinal cord above the sacral center. Okay, we all know this the center for micturition reflex is the sacral segment of your spinal cord. When the sacral segment of the spine, before higher, when the thoracic segment or lumbar segment of the spinal cord is damaged, what will happen now? The higher centers cannot contact your sacral segment of the spinal cord. Okay, so what will happen? The voluntary control will be lost. The voluntary control of micturition will be lost, and the bladder will be called as automatic bladder or neurogenic bladder. Okay, so this will happen during a gunshot injury or a road traffic accident. You have damaged your spinal cord above the sacral center. First, initially during the spinal shock period, both the micturition reflex as well as your voluntary control will be lost for 3 to 4 weeks. After 3 to 4 weeks, when you are recovering from the spinal shock, that time your micturition reflex will regain back, but your voluntary control is completely absent. So in those patients, micturition reflex can be activated by scratching the skin, near the genital region. Okay, this will cause micturition in them. Okay, this type of bladder is called as automatic bladder or neurogenic bladder. Okay, we have seen atonic bladder, decentralized bladder, automatic bladder, or neurogenic bladder. These three are very important for your exam point of view. So here till here, atonic bladder, decentralized bladder, and in automatic bladder, we have seen about the parasympathetic nerves. When they are damaged, what will happen to the bladder? All these things we have seen. So now we'll see what will happen if the sympathetic nerves are damaged. If the sympathetic nerves are damaged, maturation is not affected because they are not helping in maturation. Okay. So what will be the problem? Ejaculation failure will be there. Why? Because what the sympathetic nerves are doing? Sympathetic nerves are causing relaxation of the detrusor and contraction of the internal urethral sphincter. So they close the internal urethral sphincter. So during the time of ejaculation, semen cannot enter into the bladder because the internal urethral sphincter is closed by the sympathetic nerve. But here, when the sympathetic nerve is damaged, the internal urethral sphincter cannot be closed. Because of that, what happens is during the time of ejaculation, the semen will enter into the bladder. So no semen will come out of the urethra. This will lead to male infertility. Male infertility. So thank you. So in this class, we have studied about the anatomy of the bladder, innervations of bladder. We have studied about cystometrogram, and then we studied about micturition reflex, and we also at last we studied about the abnormalities of the bladder also. So I hope you learned about the micturition reflex and abnormalities of bladder in detail. So I'll meet you in another class. Thank you. Then thank you.